Good morning, sir. I am Galilea Lanya Mendigoria from BSN-1B, and today I am going to perform the 12 cranial nerve assessment. So first thing we want to do is to provide privacy to our patient. Next is to perform hand hygiene. And lastly, we need to explain the procedure of the test we are going to do to our patients. So first, we will perform the cranial nerve 1, or known as olfactory. So ma'am, pwede mo itulong ang imong mata. And may ara ko ipasimhot sa imo nga hulaan mo ano siya. Okay, correct. This is a coffee, and that cranial nerve is intact. Next, we will perform the cranial nerve 2, or known as optical. In testing cranial nerve 2, we're gonna go through 2 tests. First, confrontation visual field or peripheral vision, and visual acuity by using Snellen chart. So first, we're gonna go through confrontation visual field or peripheral vision. So first, we're gonna measure the distance between me and my patient for about one arm's length away. So ma'am, I need you to cover your right eye with your right hand. And I will also cover my left eye with my left hand. And you will look directly at my eyes, and I will do signals on my hand, and you will just use your peripheral vision in guessing. Okay, start. 2. And the other side, let's do it again. 2. 1. So next, we will test the visual acuity by using Snellen chart. So ma'am, may ara ka dito sa Snellen chart, and I want you to cover your right eye first. And tanawan dito ma'am kung diin mo maklaro nga number. So read it for me ma'am. F-E-L-O-E-Z. Okay, ma'am. So next, cover your left eye. And what number do you read? A. B, E, F, E, O, E, E, C. Okay. So now, I want you to read with both eyes open. Number 8. B, E, F, E, O, E, E, C. Okay, so she read from line 8, so it means that she has a 20/20 vision. And now let's proceed to cranial nerve 3, ocular motor, and 4, trochlear, and 6, abducens. So first, we're gonna check for the involuntary shaking of the eyes. So ma'am, I have here a pen light, and I will put this for about 12 inches away from your face, and you'll just follow this with your eyes. So start. Next, we are going to check how the pupils reacted to the light. And to do that, we're gonna dim the light a little bit and let our patient stare at an object from a distance away. So ma'am, I'm gonna light this pen light on the side, and we will see how the pupils will react to the light. So I'm gonna shine in now. Okay. And I'm gonna shine in now.
Okay.
So as we can see, both pupils constricted equal size. And next, we're gonna check for the accommodation. And to do this, we will use a pen light, and I will put it in front of her face, and I will move it closer to her nose, and let us check if her pupils will dilate and accommodate, and her eyes will cross. So we can now document because we already checked all the things in the eyes. So we can document that the pupils are equal, round, reactive to the light, and accommodate, or which stand for the acronym PERRLA. So now let's go on to the cranial nerve type, or the trigeminal nerve. This nerve is responsible for many things like mastication. So ma'am, can you pinch your teeth down for me? Okay. I will go now to the temporalis. And now we will check if she can open her mouth against resistance. Okay, she can do that. So next, we will go to the cranial nerve 7, or the facial nerve check. So ma'am, can you please close your eyes tightly and open them up? Now smile for me, frown, and pop up your cheek. Okay, so that cranial nerve is intact. Next, we will go to the test cranial nerve 8, the vestibulocochlear. And to do that, I'm gonna cover one of her ears, and she's gonna tell me what item. So, are you ready, ma'am? Apple, banana. Okay, I will. Water juice. Okay, so that nerve is intact. And now we are going to test the cranial nerve 9, or the glossopharyngeal. So what I'm gonna do now is to put this tongue depressor at her mouth. Are you ready, ma'am? Put up your mouth. I will do your tongue. Ah. And now I'm gonna check her labyrinth. So cranial nerve number 10, or vagus nerve, is intact because she is able to talk to me and she can swallow. Next, we're gonna test the cranial nerve 11, or known as the accessory nerve. So ma'am, what I need you to do is to move your head side to side, up and down, and I'm gonna put my hands here. So that nerve is intact. And lastly, we're gonna check the cranial nerve 12, or the hypoglossal nerve. And what I need you to do, ma'am, is to stick out your tongue and move it side to side. That's all the 12 cranial nerve assessment. Thank you for watching.